We're really focused on reducing the wait time in the emergency department and inpatient medicine. So we have a new procedure. It's called split flow. Some of the folks here who really in their activities spend a lot of time engaged with our emergency department have been constructive in helping us think this through. We need partners in this. That effort is to really break down. We actually have the data on each of these steps in terms of what the wait times are to try and move the needle. And some of this will ultimately be physical facility work. We are making sure that we understand our processes and our needs before we invest money. We have a very clever program on the elevators where energy savings are paying for the upgrade and change of all our elevators. That's a sequential effort because we've got to keep operating the building. And we are committed to serving all patients regardless of ability to pay. We do things and we will continue to do things, like I said, with pediatric trauma, but also things like offering free screenings. And as I said, we are the largest Medicaid provider in Brooklyn. That will not change. And we are committed to serving the diverse populations, and we are doing the best we can in terms of having bilingual clinical and support staff and translation services.
Can you discuss the split flow? What is that?
Sure. So our emergency department is critical for us because it's our face to the community. It's when the patient first comes to us and they come in need. We have tremendous volume. Our emergency department was designed for about 65,000 visits a year, and we get about 120,000. So it's a very intense environment. And we want to improve the experience for patients. We want them to see doctors quicker, and we want them to have shorter wait times. And so we have almost like an industrial engineering project. We have taken apart each step and each point of contact and service that is provided in the care of a patient and reprogrammed it and put it back together. And the result, the process that we've come up with to address this, we're calling split flow. In the most simple sense, we're separating out folks who have intense needs, come in, for example, by ambulance, versus those who walk in. And those who walk in are seeing a nurse right away. When the ambulance comes in, they see a doctor right away. And this is going to enable us to have more people who can handle waiting in chairs rather than on stretchers. So they get more appropriate care. And we almost are running like a mini urgent care center in the emergency department for folks with less intense needs. That enables us to speed up and focus resources on those who have more intense needs while also improving the experience of those who have less intense needs. And then, by the way, more people in chairs instead of stretchers, less space usage, and a more pleasant experience. So we're giving it a shot. Everything doesn't work. We've been piloting it. So far, the feedback is excellent, and we should have full implementation towards the end of the summer, and we'll see how it goes.